Hello there, I'm Dr. Brian McKay, Neuropathy of Core Health, and today I want to delve into the use of oxygen therapy in resolving or helping to resolve conditions of peripheral neuropathy. Um, there are a number of studies done with hyperbaric oxygen therapy. Now, hyperbaric oxygen therapy, one, is very, very expensive, but it is effective. It's showing efficacy in several studies. Um, and it's based on the autonomic nervous neuropathy tests and electromyographic findings were improved, indicating that oxygen therapy is a significant modality to be included with treating, especially diabetic neuropathies. But we have done is we've morphed that into where we're using a different way. We're still using oxygen therapy, not hyperbaric, where you would go into a chamber and just stay there. What we've done is we've taken it a step further, and we think it's just as effective, if not more effective, because what we'll do is we'll have our patients go onto an exercise bike or a treadmill and start to exercise. But we're going to concentrate to deplete the oxygen level, not completely, obviously, because then you would be dead. What we want to do is we want to bring the concentration of oxygen down by exerting the person. When you're laying in a hyperbaric chamber, there's no exertion. But what we found is when the person is exercising, we bring down by reducing, again, the oxygen concentration that you're getting. So I want you to think about if you were on say you went to Colorado and you decided you're going to go for a run and you're from the Northeast, like I am. It's going to be a lot more difficult for you to run because you're not used to that. The altitude changes the oxygen concentration dramatically. So what happens here is we put the patient onto an exercise bike for a set period of time, and then we exercise it for several minutes with a reduced concentration of oxygen, and then switch it after several minutes to an extremely concentrated oxygen level. And the idea here is that it really expands the body's, your body's looking for that oxygen. You need oxygen. You can't even live 6 minutes without having oxygen. And in doing so, when we ramp up the concentrated oxygen, the patient will then experience a burst of energy due to the fact that the blood vessels will dilate dramatically, open up, and again, you're also going to stimulate what's called angiogenesis, where more blood vessels are created. People think about cells die. Well, blood vessels die and need to be reinvigorated. So while the person's in that concentrated oxygen after depleting it, there's a rush of oxygen coming into the system. Now, one of the other things we've done to take this a little bit further is we are using blood flow restriction cuffs on the lower extremities. So when the person is on that bike or on the treadmill, we're going to put these bands around right below the gluteal fold, basically below your butt, wrap it around the upper thigh. Now, the band is not meant to cut off arterial blood flow, and it's not on that type. It's on enough that you would use it would block venous backflow. And so what happens is the muscles almost become oxygen starved, further adding to the efficacy of using oxygen therapy with the restricted blood flow. So it's a really cool way to stimulate. Now, did I come up with these ideas myself? Honestly, hell no. But what I did is the bodybuilders are now using restricted blood flow to build up biceps and legs. So what you do is you would wrap your arms. Let's just say your arms. You want bigger arms. Everybody wants bigger arms, but who wants to do it to the time? So what you would do is you would take 40% of your maximum. So say you can curl 50 pounds. 4 times 5 is 20. So you would use a 20-pound weight, and you would do it in 30 reps as fast as you can. You wait 15 seconds. You do another 15 reps. Wait 15 seconds. Do it again, and you repeat it a third time. And what happens is when you take the bands off, it engorges the muscle. So by using the restricted blood flow bands in addition to the change with the concentrated oxygen, we're getting a real big burst of blood flow. And it's almost like tricking the body to say, hey, we don't got enough blood flow. The brain says, hey, I want more. Then you give it more. And the effect is that, again, that incredible dilation of blood vessels to further stimulate angiogenesis. I mean, you kind of open up new blood vessels and create them, you're going to have better nerve connections, because one of the things is the oxygen connection with peripheral neuropathy is I think it's understated, very much so. So what happens is, people think they're going to take Lyrica, Cymbalta, gabapentin. These do nothing. Actually, they're anti-seizure medications. They're more working on your brain, okay, to ignore the neuropathic pain symptoms. I'm about coming up with ways to get the brain to recognize the need for more oxygen, give it the more oxygen, and restoring the pathway. So by using, concentrated oxygen and restricted blood flow, we're able to accomplish that. Neuropathy core health came about. I'm a chiropractor and started seeing a number of patients with peripheral neuropathy. Typically, it's due to diabetes or post chemotherapy. Some people exposure to toxins. So these are the primary people that are going to benefit the most from it. And what we have seen so far is really kind of nothing short of amazing. So if you have any questions, feel free to give me a call. Our number is 203-875-0846. 203-875-0846. Give us a shout and let's figure out if we can do something to help you. Now, I'm in Connecticut. That doesn't mean I can't answer any of your questions, because quite honestly, I'm pretty excited about this stuff. So to share information is really not a problem. I've just did a blog article on this, and so I'm kind of high on this stuff right now. I wish I had time to get on the oxygen therapy myself, but we got too many patients using it. I'm Dr. Brian McKay for Neuropathy Core Health, Fairfield County's leading provider of neuropathic pain relief. I look forward to talking to you soon. Thank you.